Good afternoon, sir.
Good afternoon.
So, as I know, you are the legend of minimal access surgery in India. So, since 35 years, you have put your all efforts to develop the department to the present state where we are getting into the robotic surgery. So, what is the real intention of you, picking up a minimal access surgery as a specialty and to develop, sir?
Well, I think I have always been fascinated with the technological development. So this is how almost 32 years back in 90s, when I came to know about the laparoscopic surgery. At that time it was known as a video endoscopic surgery.
Yes.
And how the gallbladder can be pulled out. So I got fascinated, and that's how I entered and started the surgery in 1990 in India. So the same way, but certainly we enjoyed the advantage of laparoscopy in terms of excellent cosmetic results, minimum pain, and very early recovery and back to work. But at the same time, somewhere we thought that we were missing the third dimension of the surgery, because laparoscopy became two-dimensional. And then just a few years back, when I came across this new robotic next generation system and the platform by CMR Cambridge, I got fascinated, because this is the way I feel that the future of robotics will be perceived and also will become popular, because I was missing that third dimension.
Yes, sir.
I thought it's a good opportunity that we have got advantages of laparoscopy also, and our third dimension is back now with this.
So, what are the real advantages for a young surgeons to pick it up that technology, and what is the learning curve you suggest, and which is the way the go forward as a surgeon to get this technology updated?
I feel that whatever developments are going to take now in the next decade, all the developments will probably be concentrating on the robotic technology.
Yes.
And maybe because of the motors, because of the control of those speeds and control of the power, all those motors now they are produced in masses, and it has come into the industry. So whatever industrial robots are there, I think the same parts possibly with modification will be used for medical robotics also. So I feel that future development in minimal access surgery or laparoscopic surgery will be the robotic assisted surgeries.
Yes.
Whether it is for localization, as we see in spine, or it is for precision,
Yes.
where you become more precise because of our wrist movements, it gets limited. So now we have a robotic wrist which can go to any angles, maybe up to 720-degree rotation and angulation. So I think surgery will become more precise, more accurate. And in other words, I would say, like the mathematics becomes more, the calculations become simpler with the calculator.
Yes.
So I think the same way we will be much more precise with this, and our young surgeons may have a shorter learning curve because of the third dimension they will be able to see.
Yes.
But at the same time, I think I always insisted that they should have a good training. They should train themselves well,
Yes.
and then move on to the next technological level, because we should be very sure that we are not harming our patients,
Yes.
because that is our utmost responsibility for their welfare.
Yes. So in a present trend, so the cost effectiveness of the robotic surgery, so how we can be possible to cost effectively pass on this technology to our patients, where India is basically a middle class country, where the most of our patients are middle class background.
Yeah.
So how effectively we can mitigate this cost and pass on this to the our patient?
Well, I think cost can, one single factor is to reduce the capital investment. and I'm sure, as we have seen in all the technological developments, including our telephones also, the mobile telephones, televisions, and anything for that matter, I think it is important. The number plays a very important game. First is the capital investment. I'm sure with more installations, more market demand, more number of production in the units of various robotic companies, the cost will definitely come down. So we will have a capital investment which is less. Second cost which is there of a disposable instruments.
Yes.
And as in this also, the more number of instruments which will come, the more cases which will be operated, I think the cost automatically will come down.
Yes.
And with the next generation platform like FACRSI by CMR, this is the platform which is going to work.
Yes.
The previous generation platforms were platforms which were fixed in one operation theatre.
Yes.
So this system platform can be used in multiple operation theatres. So you can do more operations.
Yes.
Also, more specialties can
Yes.
use it. The gynecologist, the thoracoscopist, and all type of surgeons can use it.
Yes.
And when the more specialties are using it, then the chances are
Ready.
that it will be more cost effective.
Yes.
But I'm sure, I think this same question what you asked me about the cost came to us 32 years back. But then we have realized that now the cost of a laparoscopic surgery is practically at par for what used to be for the open surgery.
Yes.
It's because of the numbers and more centers, more doctors using it. Like that.
So at the outset, I congratulate you for completing your 500 robotic surgery. As we know, in India, you are a father of minimal access surgery. Now you are going to become a father of robotic surgery as well. So we congratulate you. Thank you so much.
Thank you.